Welcome to our channel. Today, we're going to discuss a common but serious health condition, hypertension, also known as high blood pressure. We'll cover its classification, definition, causes, symptoms, investigation, and management. So let's dive right in. Hypertension, or high blood pressure, is a condition where the force of the blood against the walls of the arteries is consistently too high. Blood pressure is measured in millimeters of mercury, or mmHg, and is given as two numbers: systolic pressure, which is the pressure in your arteries when your heart beats, over diastolic pressure, the pressure in your arteries when your heart is resting between beats. A normal blood pressure reading is typically around 120 over 80 mmHg. Hypertension is diagnosed when the blood pressure consistently exceeds 130 over 80 mmHg. Hypertension is classified into several stages based on blood pressure readings: normal systolic less than 120 mmHg, and diastolic less than 80 mmHg. Elevated, systolic 120 to 129 mmHg, and diastolic less than 80 mmHg. Hypertension stage 1. Systolic 130 to 139 mmHg, or diastolic 80 to 89 mmHg. Hypertension stage 2. Systolic greater than or equal to 140 mmHg, or diastolic greater than or equal to 90 mmHg. Hypertensive crisis, systolic greater than 180 mmHg, and or diastolic greater than 120 mmHg, which requires immediate medical attention. Hypertension can be categorized into two main types based on its causes: primary or essential hypertension. This is the most common type and has no identifiable cause. It tends to develop gradually over many years and is influenced by factors such as genetics, age, and lifestyle. Secondary hypertension. This type is caused by an underlying condition. Causes can include kidney disease, adrenal gland disorders like Cushing's syndrome or hyperaldosteronism, thyroid problems, obstructive sleep apnea, certain medications such as oral contraceptives or decongestants, alcohol abuse. Hypertension is often called the silent killer because it typically has no noticeable symptoms until it has caused significant damage to the body. However, in severe cases or hypertensive crises, symptoms may include severe headache, shortness of breath, chest pain, vision problems, dizziness, nosebleeds, and, well, even fatigue or confusion. Hypertension is diagnosed and monitored through regular blood pressure measurements. However, to assess the impact of high blood pressure and to rule out secondary causes, the following investigations might be performed: blood tests to check for underlying conditions such as kidney disease, diabetes, or thyroid disorders; urinalysis to detect the presence of protein or other abnormalities that indicate kidney damage; electrocardiogram, or ECG, to check for any signs of heart disease; echocardiogram, which is an ultrasound of the heart to look for structural changes or damage caused by high blood pressure; renal ultrasound to check for any abnormalities in the kidneys; and ambulatory blood pressure monitoring, a 24-hour blood pressure monitoring to assess how blood pressure changes throughout the day and night. The management of hypertension involves lifestyle changes and medication, depending on the severity of the condition. Lifestyle modifications. Adopt a heart-healthy diet such as the DASH, dietary approaches to stop hypertension diet, which is rich in fruits, vegetables, whole grains, and low-fat dairy products. Limit sodium intake to less than 2,300 milligrams per day, or ideally less than 1,500 milligrams per day for adults with hypertension. Engage in regular physical activity, such as 150 minutes of moderate intensity exercise per week. Maintain a healthy weight. Even a small weight loss can help lower blood pressure. Limit alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. Smoking raises blood pressure and damages blood vessels. Medications. Help the kidneys remove excess salt and water from the body. Block the production of a hormone that narrows blood vessels. Relax blood vessels by blocking the action of the hormone that narrows them. Help relax the muscles of blood vessels and reduce the heart rate. Reduce the workload on the heart and help it beat more slowly. Depending on individual needs, other medications such as alpha blockers, alpha-beta blockers, or vasodilators may be prescribed. Regular monitoring. Patients with hypertension should regularly monitor their blood pressure, either at home or at a clinic, and follow up with their healthcare provider to ensure that their blood pressure remains within the target range. Hypertension is a manageable condition with proper treatment and lifestyle adjustments. If you have high blood pressure or are at risk, it's crucial to work with your healthcare provider to develop a management plan that's right for you. Thanks for watching, and don't forget to like, share, and subscribe for more health information.